So this podcast is about love and compassion at RJH. What is RJH? Yes, Royal Jubilee Hospital. Last Thursday, when it was Thanksgiving in the United States, here in Canada I was going in for day surgery. A simple procedure, they said, and yet very difficult. So let me set the scenario. At 7 a.m., we all arrived at the hospital. But all of the patients going for day surgery, like me, got up probably at 5 a.m. and after not too much sleep, and washed with that funny, foamy, brushy thing that is antiseptic in every way. Smells terrible, feels terrible, itchy, but you are essentially a sterile environment. Get to the hospital, we have to actually check into the surgical room by 7 a.m. And we're all obediently in a line, about 6:30, and it's kind of quiet and a little terrifying because there you are with a mask on and with your form and your papers and you're checking in and they're telling you where to go. Go down this hall, go up to the 3rd floor, turn right, go down, and then you'll see the sign saying day surgery. Most of us are sort of standing there fairly obediently, but you can feel the tangible, quiet fear of all of us standing there. Not only the upcoming patient like myself, but also our partners, because nobody goes into day surgery because nothing is wrong. Something needs to be fixed. And so this quiet group, myself included, and my wonderful partner and I, slowly go through the check-in, answering all the questions, getting the directions, and then making our way to the elevator. In the midst of the questions, before we went to the elevator, a man rushed up and said, I'm due to have my surgery, I'm late. And security basically said, wait your turn. You don't have to worry if you're for day surgery. You won't go in right away. So he calmed down. He looked pretty stressed, and we all proceeded. When we're up in the room, we're sitting in a sort of oval-shaped room with one side door off to the left, and at the end, doors into the surgical area. And we're sitting there with our papers that we had been given, and we're waiting. And we're waiting. None of us had had day surgery before, or at least I assumed, but I hadn't, so there we are, we're waiting. And it's pretty tense. It's pretty quiet. And then one lady that's sitting beside us with her husband who's going in for surgery gives him her clutch purse to hold. And the typical Jeffrey kind of humor says, oh, that looks good on you. And he bursts out laughing and says, yeah, it's rather cute, isn't it? And then suddenly the atmosphere broke. And slowly but surely people smiled and said, what are you here for? And are you okay? And a little kind of support and genuine connection started with everybody. And it started with us 6 in this little corner. And then slowly it pulled the rest of the room in. Comments about the weather and comments about how nice the staff are. And here the fear kind of dissipated, but you could feel it underneath but we were all making the best of it, trying to handle whatever thoughts and feelings that we were having. My own thoughts was, well, I hope this works this time, because I was there to have something repaired that had been done 6 weeks earlier by a different surgeon. And that was as a result of something that happened in January. So I was a little apprehensive, although the new surgeon that I was seeing was, I would have to say, a hale and hearty kind of guy. He was very much okay with everything. Don't worry, I'll take care of you. You will be fine. It sounded all reassuring, but there was that little niggling, nasty voice that sometimes we all get, and I get very particularly, that says, oh yeah, It's kind of cynical and says, yeah, I don't know about you. I don't know who you are. You've been sent to rescue me, but that's what the other surgeon said. Anyway, I'm still sitting there. My wonderful wife is having the occasional cough as we're sitting there, and we've all got masks on. Then suddenly a nurse opens the doors, and we all look down at the end of the room, and she comes out and she asks for our forms, and she says, oh, looks at mine, she said, oh yes, and she takes our forms one by one around the room and then disappears. So we've already been sitting there for about 35 minutes or so, and then suddenly we notice a stream of nursing and equipment and people down at the end of the room setting everything up. And that quietens the room down again, because we're all going, oh, that's where it happens. As it turns out, that's not where it happens. That's where they take you to prep you. So slowly but surely, a nurse comes out and collects a person. And about half the people are being collected, and then suddenly I'm collected, and we're led into the prep room, as I now know it to be called. A very nice young nurse who looks at me and says, what are you in for today? And she sees, oh, because I'm in for an adult circumcision because of an attempt to repair what happened before. And I'm actually 77, and I'm going, oh my God, what am I doing? Anyway, they get me stripped down and get ready, and I'm laying there in a gown, and I am prepped. I've got little booties on, and she's given me a hairnet, and she said, oh, you look cute in that. And I'm laughing because they've taken, I have no wedding ring, no identification, no watch, no phone, and I'm laying there in a breezy gown. And an older nurse comes up and says, you're looking cold. I said, yes, I am. And she comes back with two, delicious blankets that are warm, and she drops them on me. She said, that will help. The anesthesiologist will be here soon. And I noticed that she's going around talking to people, and she's like carrying a wave of calmness and gentleness and kindness with her. And she's giving blankets and finding pillows. And then I noticed that she has a slightly different jacket on than the rest of them. And she seems to be organizing, orchestrating things and making people comfortable. It's an amazing effect. She is quietly compassionate, and she's strong, and you feel reassured. Because it's often difficult when you're sitting in your own fears to understand what is going on. Anyway, out comes the surgeon, and he says hi to me. And he's very upbeat, and he's very direct, and he says, "Don't worry, I am here to take care of you. This will be fine. The anesthesiologist will be here in a minute or so, and we're prepped and ready for you as soon as he's gotten you set up, and then we go." A few minutes later comes the anesthesiologist, and he asks me questions, asks me what I'm having done. He said, "I see you've had surgeries before." And I said, "Yes." And we go through the list. He asked me about what medications. Now, I've already done all this, both by interview and online with them, so I know he has everything there in front of him, but he's just checking with me. And he looks at me and he said, "You know, I'm not going to put you under," which is what we would normally do. He said, "Given your age and what you're having done, I'm going to give you a spinal tap or spinal block." And he explains what that is and where the injection is. And I turn on my side and he looks, he said, "Yeah." And here is his assistant, and he says, "Yes, we can do it right here. This will actually be better for you." And I said, "Okay." We go over a little bit about the medication, and he says, "It'll last longer and you won't feel a thing." Sure enough, I feel a little prick in my back, just above my hips, and then nothing. I'm wondering what he's doing. And I'm waiting, and I'm waiting, and then he pulls the gown back down and lays me down, and he says, "Okay, raise your knee." I couldn't raise my knee. I was numb from the waist down. It was the strangest sensation. And I said to him, "Is this what it feels like to be a paraplegic?" He said, "Absolutely." He said, once you've felt this, you will look at a paraplegic in completely different eyes, because they live this way permanently. Imagine not being able to move your legs by yourself. Your leg muscles don't work. Your bowels don't work properly. Everything has to be managed. He said, "Go ahead and try and wriggle your toes." Couldn't do it. He said, "Well, we know you're ready." And he said, "I will be in the room, and I will be monitoring you there. So I'll see you later." Off he goes. A few minutes later, a nurse comes in, checks my name, my identification, asks me my birthday and all the regular things to make sure they got the right patient. And in we go to the operating room. So there we are. And the surgeon says, "Okay, I understand you've had a spinal block." That's really good, because you won't feel a thing when I'm doing it. And I'm going to give you a deeper block so you won't feel anything in that area for the next 12 hours. I said, "Okay." So he said, "We're going to put you up on the table." And I go to try him. He said, "You won't be able to move." He said, "Let us do it." And they pump the chair, not the chair, but the bed up, and they slide me over. And they're all gently talking to me and making sure I'm okay. I'm really impressed by their energy, their caring. And then the surgery. As he starts the surgery, he starts to talk to me. And I said, "No, that's okay." He said, "Do you want to see?" I said, "No, I'd rather just lie back and not see anything." He said, "Okay, fair enough." And I actually don't remember very much from that point, because they put a little mask on my face and had a little gas in it, and suddenly I am quietly in a different world. Then that comes off, and he said, "Everything went well, and I'll give you all the instructions, written and otherwise, when you're a little bit more here. I'll come and visit you in your recovery room." I go back in the recovery room, and I'm laying there kind of out of it. There's really just a cotton gauze curtain around your bed. So it means that you can hear the conversations on the other side of the curtain. And there's nothing else to listen to. And I'm trying to wiggle my toes, and of course that's not possible. And the man that had been sitting opposite me that I teased about having a clutch purse, the doctor and the nurse is talking to him about the pain he's experiencing. And they're telling him that what they have got going in through his bloodstream is to start the procedure of cancer therapy. He has cancer. And they tell him it will be very irritating and a little painful, but they have to start as soon as possible to help him. And the way they talk to him is amazing. They're talking about what he needs to do and how is he going to be, and that they've already spoken with his wife, and they're going off to set up his next appointment with the cancer clinic, part of the hospital. It brought tears to my eyes, the amount of love and compassion that they had for this man. They knew he was in for a difficult time. But I was inspired by his responses. I'm going to fight this. This is just a way. We just have to do what we can and do the best that we can. And I'm thinking about that smiling face in the waiting room, and now this slightly anxious voice being brave. And what I see in my mind is a 4-year-old that is being brave and being funny. They keep him quiet and they sedate him, and it goes quiet there. I'm still laying there kind of numb from hearing the conversation. I'm wondering about my own operation. Is everything okay? When I hear a voice on the other side. It's an older, frail voice that says to the nurse, "Did everything go okay?" And she said, "Oh yes, we found what was wrong with your pacemaker." And this nurse, it was like, her voice was like a cuddle. I don't know how else to explain it. It was like an embrace. And she's talking to this frail old lady, and in the conversation, I hear that she's 92 years old. And she says to the nurse, "You know, this is my 3rd one." She said, "Oh, you've been doing really well, and you're really brave." And the love and compassion is just overwhelming. I hope you can hear it in my voice. The people that take care of us, the people that do this for a profession, I don't know if they do it for a living. They must do it because it's a vocation, that they have such capacity for compassion and love for other people. I'm in total admiration of the care that was being given this lady. They chat away about her charging the battery and how they do it. And she says, "Oh, that's new." And I can hear this bright voice, but I can hear the age in the voice. She settles down, and all of a sudden, the same lady is there looking on at me. "How are you doing?" I said, "Well, I'm okay. I can't feel anything from my waist down." She said, "Yes, you had the block, didn't you?" And she said, "But I've got to take your blood sugar and she takes my blood sugar." She said, "It's apple juice and cookies for you because your blood sugar is low. That's what's giving me the ping here." So she goes off and gets a couple of cookies and some painkillers and some apple juice. And I feel like I've got the gift of the world here looking after me. Yeah, the gift of compassion. It's an amazing thing. Well, cut a long story short, or shorter, everything was okay. Surgeon visits. Finally, the pain block dissipates and I can walk. And my lovely wife picks me up and takes me home. What I didn't realize was one of the gifts that she gave me was a cold. She had a cold. And in my weird state, I picked it up right away. Now I call it a gift because it forced me to slow down. Me and my energy, I try to do everything I can, probably all at once, and overwhelm myself. But when you've got a cold, which you can probably hear, you just have to take it easy. But in my mind and in my heart, I can still hear all of the wonderful voices and experiences, and some of the sad experiences at the Royal Jubilee Hospital in Victoria. Compassion is free. It's not an expensive gift. Listening to people and caring to people and understanding them is the best gift that you can ever give. Witnessing another person when they're having a difficult time and offering encouragement is the best gift you could ever give. So I wanted to tell you about that. Love and compassion at the Royal Jubilee. I've been practicing a lot more compassion, especially for myself, as this procedure is quite painful and with a cold. But I send you all love and compassion, courtesy of the Royal Jubilee Hospital.